I'm Jennifer Zeppelin with Take5. Thank you for joining us today. May is Mental Health Month, and every year millions of Americans face the reality of living with a mental illness. Now, the National Alliance on Mental Illness says that 1 in 5 adults will actually go through a health crisis, a mental health crisis in their lifetime. Joining me now is Dr. Christina Talerico with AltaPointe Health. She's a board-certified psychiatrist, and you're here to kind of help educate us on this topic. It's really interesting to see now that it's become so common, mental illness, but are there ways to treat it?
Yes. The fortunate thing is we have a lot of therapy in our community that's available. There's lots of different treatments other than therapy as well, including medications. There's newer technologies like something called TMS, which is transmagnetic stimulation that doesn't require medication. We do always recommend if medication or other methods are used that they're combined with psychotherapy because it can be very effective.
Well, it's good to hear that there's so much of that out there today available to people, but at the same time, why do you think they don't seek treatment?
Unfortunately, cost has been a big issue. Also, unfortunately, there's long waiting times because people seek help a little bit later than when their symptoms first start for different reasons. And so a lot of stigma also exists as well, where people feel like they're failures or they take it personally that they're struggling with mental illness. So they might seek immediate help for a physical injury, but if they have a mental crisis, they're not as eager to seek treatment right away.
And speaking of that, when you talk about the treatments and things, when should somebody really seek help?
Whenever they notice an impact to their functioning, whenever they feel like everyday life has become a burden or very stressful or overwhelming. Also, substance use is a big issue in our community. So if you notice you're intaking more alcohol, you're smoking marijuana, your nicotine or vaping use has gone up, that's also a warning sign that your mental health is declining.
And you also discussed, we talked about this earlier, children.
Yes. So I specialize in children and adolescent psychiatry. I deal with a lot of teenagers with mental illness. We're seeing a huge increase in mental illness in children from age 6 to 17, as well as in young adults. About 1 in 5 to 1 in 6 children develop mental illness symptoms in a given year, and we're seeing an uptick in suicide, where suicide is now the second leading cause of death in the age of 10 to 14 population. We're seeing in young adults 1 in 3 will have mental illness symptoms in the age group of 18 to 25.
Thank you, Dr. Talerico, for being here with us. For more on the Care Line, you can get all the information at the bottom of the screen.